It's about 5%.
5%.
Depending on how you define long COVID, there are various definitions and whether it's at 1 month or 3 months. But the figure being used at the moment is around 3 to 5% of people that have COVID will go on to develop long COVID.
So what are the symptoms then, and do they vary a lot from person to person?
Yeah, absolutely, Ros. That's a great question. So the symptoms are very varied. There's said to be more than 100 different potential symptoms that can arise with long COVID. Most commonly, though, it relates to fatigue, breathlessness, chest pain, chronic cough, concentration difficulties, memory trouble, muscle strength loss and muscle pain, memory disturbances. Those kind of general symptoms are the most common.
And is there a typical patient who will go on to develop long COVID? Can you pick who's likely to go on to get the condition, right, and who's likely to recover completely?
Sure, that's definitely a challenging area, and there are many exceptions, but generally speaking, the people that have been hospitalised with COVID and had a more severe infectious course with COVID, those hospitalised people are more likely to go on and develop long COVID in the weeks and months afterwards. But there are many cases of people that had COVID, were managed in the community, didn't get particularly unwell initially, but then went on to develop long COVID as well. So it is a bit mixed, but definitely severe COVID initially is a significant risk for long COVID later.
All right. And do your chances of developing long COVID increase the more times you contract the virus?
That's a great question, and that's a hot area of research at the moment, but it certainly appears so. And perhaps one of the reasons is, as we know, COVID itself does cause dysfunction of various organ systems. So, for example, if you've been hospitalised with COVID, you're more likely to come out with cardiac scarring or lung fibrosis. So if you get COVID a second time, that can exacerbate those problems and then set you up for having long COVID in the weeks and months that lie ahead.
This is perhaps a tricky question, Jason, but what is it that we don't know about the condition? Which aspects of long COVID do we need to know more about?
Look, there's so much, Ros. It's just a great question again. So firstly, what causes it? Even that appears to be different among different people. A root cause appears to be persistent activation of the immune system, but that may involve persistent virus in the system. It may involve trouble with the clotting system, so there may be ongoing small blood clots that appear and ongoing activation generally. So that leads to the second question is, what sort of specific treatments can we develop for long COVID? At the moment, there are no specific treatments. We're using symptomatic measures such as pain control, physiotherapy, analgesics and so on. But there's intense research going on around the world to develop specific therapies for long COVID, but those therapies are likely going to be different for different people depending on what the underlying core problem is for specific individuals, whether it's immune activation, blood clotting or other factors.
And is it frustrating for patients who have long COVID to access medical attention, Jason?
Yes, there's a limited number of long COVID clinics. St Vincent's Hospital in Sydney, where I'm based, does have a long COVID clinic, but the wait times are stretching into months now for that. And it's definitely challenging. And I think long COVID also poses a lot of stress and strain on our families and our society. People are trying to manage families and do carer duties and hold down jobs. And if you've got symptoms of chronic fatigue and so on, that can make it really challenging. So I think it is placing a significant burden on our society on multiple different levels.
The federal government says it's funding research into better understanding long COVID, and that the College of GPs is updating guidelines on long COVID patient care. What else do you want to be done?
Look, I think the government is doing a lot, and I don't think we need to keep focused on the fact that the government in Australia as a whole has done a fantastic job getting to this point in COVID where we've got the large swathes of the population vaccinated. But still, there's so much to learn about long COVID, and I think we do need a unified approach to long COVID that cuts across, federal and state boundaries, where people can access healthcare and get the treatment they need to get through long COVID. And the research that goes on to support that, as I said already, around the cause and specific treatments for long COVID will be greatly welcomed.